We are looking at oral health. So many people fear going to the dentist or just assume going for those dental checkups. So on this part, you'll have a look at what exactly happens during a dental checkup.
So here we have our patient who has come in and we want to examine. First thing that we always do is do a general check in the patient. We look at their face. Is there any part that is swollen, or do they have like an abscess or anything like that? Do they have any cuts on their face and things like that? We check to see whether their lymph glands are swollen. It can be a sign of an infection before now we get into the mouth. Okay. So what we do, we have our light here, which we shine into the mouth, and then we'll ask the patient to open wide. Okay, so here we have a mirror and a probe. Yeah? So these are baseline tools that we use for diagnosis. The mirror helps us to see the teeth, and the probe has one sharp end, sometimes two sharp ends, to help and see if there are any cavities or decay in the teeth. So we usually like starting from one side. We can start from the right to the left and then go systematically around the whole mouth. We don't only look at the teeth, we also have a look at the soft tissues in the mouth, okay? So the oral cavity is made up of the lips. We have the upper lip, the lower lip. It's made up of this, we call the oral mucosa. These are the tissues inside the mouth. It's made up of teeth, and it's also made up of the tongue. Maybe you can remove your tongue out. That's the tongue. And it's also made up of what we call a hard palate, which is the tissue at the back of the front teeth, and a soft palate that is at the back. Okay, and then as we go back, we have the throat, yes, and the tonsils and other structures in there. So we always have to look at all the tissues in the mouth, and also we have the tissues at the floor of the mouth. We call it where the tongue lies, at the bottom of the tongue. That's what's called the floor of the mouth. So we'll take our mirror and our probe and use our mirror to just look inside, okay, reflected by the light. And then we'll use our probe to go through the teeth one by one to see whether there's having any decay. And we look at all surfaces of the teeth. So we will look at the front, we look at the inside, and here at the sides where the teeth contact. Okay, just to check if they have any cavities. And we'll also ask the patient to report if she feels any pain or what we call tenderness if I touch any of the tooth. So I might touch a tooth like this, press it in, ask the patient, is there any pain? No. So that tells me that tooth is not having any issue. But if a patient reports that they are feeling pain, we also mark it in our mind and remember to note it that tooth was having maybe a feeling of pain, or if I press around the gum and some pus comes out, then we're able to tell that tooth is having an infection, okay? Then we also check the condition of any feelings that the patient has. This patient has a feeling at the back tooth, yeah? So we look at it to see if it's broken or if anything is wrong with it. If it's fine, we can also inform the patient that feeling is fine so that they know that they are okay, okay? Sorry. Then we also look at the gums, okay? These are the gums, okay? So her gums are healthy. They're not bleeding when we touch. They're not swollen. Yeah. Sometimes when we look inside our teeth, at the back part of the tooth, down here, you might find what we call calculus or tartar. So it usually builds up around this lower teeth. And most patients are able to see, because when they look in the mirror, they're able to see the bottom teeth. Usually it's easier to see the bottom than the upper teeth. Yeah. So if you find that you have a yellow colored or a cream colored hard tissue just here along the lines of your tooth, it's also good to come for a checkup, okay? Yeah. So in case I find that maybe I'm suspecting the patient has dental decay between the teeth, I can send her for, okay, you can close. I can send her for what we call dental radiographs or x-rays. So what dental radiographs do, they're able to pick up if there's any decay in between the teeth where our eyes are not able to see very well, or where we're not able to pick up with the probe. If it's a first-time visit, sometimes you might ask for x-rays of both, of the whole mouth, of the whole teeth, so that we're able to see the general state of the teeth at that particular time. If it's a continuing patient and we have maybe their old x-rays and we have already done treatment, we just confirm that the fillings are fine, then the patient is not in any pain, that there is no infection, we don't have to keep doing the radiographs.
According to statistics conducted in Kenya, more than a third of the Kenyan population suffer from tooth decay. This is due to poor oral health-seeking behaviors. The same statistics found out that more than 43% of the Kenyan population only brush their teeth once a day, with 9% brushing their teeth 2 to 6 times a week. The same research found out that more than a quarter of the Kenyan population avoid smiling due to bad teeth.